Thank you, Madam President. Madam President, I want to congratulate the ranking member and chair for their good work today on this legislation. There are a couple of amendments that are part of the underlying bill that I'd like to speak briefly about. The first has to do with prescription drug abuse, a problem we all face as representatives of our states. And I want to particularly thank Senator Whitehouse for his partnership on this important bill. In the past decade, unfortunately, prescription drug abuse has reached epidemic proportions in states like Ohio and in so many other states around the country. In doing so, it's devastated the lives of so many individuals, but also the well-being of our communities and, of course, affected their families, affected our economy. It's caused a big spike in crimes, including theft, as addicts have looked for ways to support their addictions. And the crime, of course, has doubly strained law enforcement, which has already had to contend with this increase in drug trafficking with constrained budgets. It's also served, unfortunately, as a gateway to other drug use, including heroin use, which tends to be less expensive and has caused additional public health challenges. Amazingly, since 2007, drug overdoses have now moved ahead of car accidents as the leading cause of accidental death in my home state of Ohio. And again, we've seen this, unfortunately, too often around the country. We've had record levels of hepatitis C infection from needle sharing. In one county along the Ohio River in southern Ohio, 10% of the babies born in 2010 had drugs in their system. The good news is progress is being made in places like Scioto County and around the country thanks to the hard work of law enforcement, local, state, and federal officials, community groups, family schools, churches, and others. But they need some help. More work needs to be done. And one tool they're looking for in the fight against prescription drug abuse is a better way to monitor prescription drug use. There are databases around the country called prescription drug monitoring programs. They allow states to monitor and track the dispensing of prescription drug medications by healthcare providers to be able to identify abuse and stop abuse of people getting prescriptions for these drugs in various different doctors' offices and what have been called pill mills. Preliminary research has shown that monitoring programs are highly effective in stemming the tide of abuse. That's why 41 states and one territory now have them. There's a problem, however. Different states' monitoring programs can't communicate with one another. So one state doesn't know what the other state is doing. And drug trafficking is an interstate problem. This is especially true in places like Scioto County in southern Ohio, right across the river from Kentucky and very close to West Virginia. So we want these states to be able to work together. That's why Senator Whitehouse and I have offered this Amendment 2145. It's a federal solution providing a framework for monitoring programs to participate in data sharing across state lines. The amendment also supports collaboration between the Department of Health and Human Services and the Bureau of Justice Assistance in order to further their research to assess challenges that have an impact on state interoperability. Some have called for a national monitoring program, one federal program. I don't think that's necessary. I don't think it'll work as well. A lot of states have programs that are working extremely well. They put a lot of money into it, and it's based on differing protected health information standards state by state. So rather than trying to federalize it, our amendment gets these disparate programs to work together securely, reliably, and efficiently without undermining or jeopardizing the state autonomy in this area. States should remain free to establish laws that determine user eligibility and reporting requirements, for instance. So this legislation is smart legislation to help, again, give these communities the tools they need to fight this prescription drug abuse. Finally, I would say our amendment has no effect on direct spending or revenues over the 10-year period. The other amendment I want to mention also has to do with substance abuse. It's about the dangers of what we've, unfortunately, all here in this chamber heard about, which is synthetic drug abuse, including K2 spice, bath salts, herbal incense. Today, we have the opportunity to do something about this problem. Let's prohibit these drugs from getting into the hands of our children, our servicemen and women, and others. This amendment addresses the growing use and misuse of synthetic drugs by placing 15 synthetic drugs, 2 stimulants, 9 hallucinogens in Schedule 1 to expose those who manufacture, distribute, possess, import, and export synthetic drugs without proper authority to the full spectrum of criminal, civil, and administrative penalties, sanctions, and regulatory controls. I'd like to give special thanks today to the people who've really led this effort here over the years in this chamber, Senator Grassley, Senator Schumer, Senator Klobuchar. They've worked hard on this issue, and We're all pleased that this is part of the underlying legislation. Senator Grassley, as well as folks from the Community Anti-Drug Coalition, originally introduced me to this rising prevalence of designer drugs. I was told about the story of David Michelle Rosga and others who have suffered some of the deaths that have occurred around the country. The amendment, again, would have no significant effects on direct spending or revenues over the 10-year period, and again, is a good common sense approach to trying to get our hands around this issue, help the constituents we represent, help our communities to fight, to stem this substance abuse that's affecting us all. Madam Chair, thank you, and I yield the floor. Madam President, I yield back the remainder of my time, yield the floor, and note the absence of a quorum.